everyone, welcome to KHA Homeopathy Study Group webinar that provides continuing educational credits. It is to provide extensive in educational purpose of holistic approach with professional homeopathic webinars as well as in wellness, homeopathy, yoga, Reiki, meditation and much more. We value and treasure human collective as our honorable peace and we bring world-renowned homeopaths to our webinars. This is Kavita Kohunur from Michigan, USA, President and CEO of Kavita Holistic Approach. I am board certified homeopath and outreach coordinator of CHC PR committee. I'm a member of Kevin Friendly Foundation, a non-profit organization that helps to serve people, poor people in greater needs in India. Today, June 6, 2020, our topic of our webinar is Management of Cardiac Disease by Homeopathy by Dr. Aadil Chimthanawala. Everyone knows Dr. Aadil, no introduction is needed. He's several years experience, more than 25 to 30 years experienced homeopath. But for those who do not know, he completed, after completing MBBS, he did PHMS and MD Medicine Homeopathy. He worked for DNP as a resident physician in the Department of Cardiology at the Postgraduate Institute of Medical Sciences and Super Specialty Hospital, Nagpur. He is the Secretary of National Academy of Homeopathy. And he is looking for overall administration and the conduction of postgraduate homeopathic residential schools at the late J.N. Sanjilal Memorial Workshop. He is also appointed as mentor and PG guide to give complete guidance to postgraduate students in homeopathy by the Handyman College of Homeopathy, United Kingdom. We have so much to talk about him. Whole 1 hour will go. He has so much academic skills and clinical expertise. We have a wonderful educational webinar carefully prepared for you. So please send your questions in the chat and Dr. Aadil will answer at the end of the presentation. This webinar is moderated by KHA Homeopathy Study Group team, Dr. Deepak Sharma, Professor Regina Rianelli, Dr. Smita Singh, and Professor Dr. Nikhil Kamble. This webinar is for educational purposes and it is being recorded as we speak. In order to receive continuing educational certificate, you need to fill the jot form, which is going to be provided in the chat. And there is a CHC job analysis, psychometric analysis for the CHC exam development. So that survey link will also be provided. They get 1 CHC CU and 1 NASH CU, which is an, and there is upcoming joint American Homeopathy Conference JAC 2020 that we have made several promo videos. It's a global pandemic summit. Do not miss that opportunity. It's a one-time opportunity and historic. I will be there as a speaker too. And we have Nobel Prize winner at this conference. So we will share more about it later. And let us welcome Dr. Aadil Chimthanawala to our webinar.
Thank you. Well, friends, good evening. And thank you very much, Doctors Kavita and Dr. Deepak. Hope you all well. And amidst the season of coronavirus, we are talking about cardiovascular disease. In fact, in all age groups, if you study, talking about coronavirus properly, cardiovascular disease patients are the most dangerous group of people. Well, today I'm going to talk about, I'm going to give you a bird's eye view about what different diseases we can get in homeopathy as far as cardiovascular system is concerned and what a homeopath can do, a rough idea. I'm overwhelmed and I thank Kavita Holistic Approach, the study group to give me an opportunity to address you. And now I think it's time to start. Well, friends, heart diseases. So heart diseases we have divided into different groups. We'll be discussing each group as we come to it. The commonest heart disorders which a homeopath can get in today's setting are the ischemic heart diseases. What are they? We'll come to it. Then comes the hypertensive state. Valvular heart diseases, particularly in India and the Indian subcontinent, It's very, very prominent valvular heart diseases, and homeopathy has got a great scope in this area. Rhythm disorders, arrhythmias, heart failures, congenital heart diseases, infections of the heart, and heart affected due to other disorders like diabetes, like autoimmune disorders, like other drugs, etc., etc. So, one by one, let us start covering. Before we enter into the heart, I'm going to give you a view about the anatomy of the heart. The heart never ever steals blood from its own chambers. As we all know, heart has got four chambers, the two atria and the two ventricles. When a homeopath or a cardiologist talks about heart, we are basically talking about ventricles. Atria are accessory chambers. That is why the name atrium. Atrium is an accessory room or an accessory chamber. So we have got the left atrium and the left ventricle. It is connected by a valve called as mitral valve. The right atrium and the right ventricle connected by a valve called as tricuspid valve. Mitral valve is a bicuspid valve, and the tricuspid valve is a three cusps. Then we have got the left ventricle continues forward in the form of aorta and is guarded by a valve called aortic valve. The right ventricle continues forward with the pulmonary artery, which goes to the lungs, and that is guarded by the pulmonary valve. Now, since I said that heart never steals blood from its own chambers, but like any other organ, it has its own rich blood supply. They are the coronary arteries, and the coronary arteries are the direct offshoots or the direct branches of the aorta. In fact, they're the first branches of the aorta. If these arteries are blocked by cholesterol debris, then slowly and steadily the supply to the heart, particularly in times of exercise and exertion, keeps on decreasing. For example, if the patient walks, climbs up steps speedily, he or she may experience some sort of chest discomfort, and this discomfort is called as angina pectoris. Mind you friends, angina is just pain. We use angina for different reasons. You have got angina of the stomach, you can have abdominal angina, you can have angina of the jaw, but chest pain is called as angina pectoris. Now, over a period of time, if this blockage keeps on increasing, then the blood supply to that part of the heart is stopped and can then result in a heart attack. In our studies, myocardial infarctions, MI means myocardial infarctions, they are greatly related to the mental state of the patient. In fact, we have noticed that patients invite a heart attack, meaning thereby that because of the blockage, you can get angina. And unless and until that coronary plaque, that cholesterol plaque, it ruptures, it bursts, till that time, you cannot have a heart attack. So heart attacks are generally invited. Now, how do those plaques burst? For example, if you have a tendency to atherosclerosis, plaque formation tendency is called atherosclerosis. So if you have a tendency to atherosclerosis, the arteries start getting blocked at the age of 8 to 9 years. Just imagine, your heart gives you so much time at the age of 8 to 9 years, and you get heart attacks or angina pectoris at the age of 45, 50, 55, 60 years. These many years, you have done nothing for the heart. And I'll tell you, as homeopaths, we can do lots and lots of things from this very age for people who have that tendency. And how do I know that I have that tendency or not? So, in our studies, myocardial infarctions are greatly to the mental state of the patient. So, whenever the patient comes to me, heart attack patient, or if I'm called to attend a heart attack patient, even during that pain, the first thing I ask is, why did you get a heart attack? What was the event preceding the chest pain? What was the event? Some unresolved conflict, something. Why I say that? Because that subconscious mind accelerates the sympathetic nervous system, and whenever the sympathetic nervous system is activated, hyperactivated, what happens is coronaries go into spasm. And the moment the coronary goes into spasm, then it should relax within 3 seconds. If it is not relaxing, it will crush that plaque. And the moment the plaque is crushed, then it ruptures, and that rupture can lead to a heart attack. So, mental state of the patient is an extremely important factor when we are treating heart attack patients, and that is how we decide medications. Now, angina can present as many ways. Chest discomfort. It is not pain. It is just a discomfort where the patient says, "Doctor, I don't know what is happening to me." Now, this discomfort is generally in the center of the chest, not left side, not right side. Generally center of the chest. It may radiate to the left upper arm up to the fingers, the two fingers, there's a little finger and the ring finger. This is the classical Heberden's angina, which is called, or the psoric angina, which is called. I'm not going to go into the miasm of this aspect, but whenever the person is under stress, whenever the person overexerts physically or mentally, there is a vasospasm. Vasospasm along with that blockage together leads to angina. A heart attack is possible only if the blockage extends or is increased more than 70%. Like if this is the diameter of the vessel, slowly, if it's 30%, 40%, 50%, 60%, no worries. 70% chances are there. 80, 90, 100%. Now if the vessel is blocked, there are chances of rupture. And that is the reason why we connect these two, that is cholesterol plaque with heart attacks. The second most common symptoms of angina is breathlessness on exertion. Now, how to differentiate breathlessness of an asthmatic and breathlessness of a cardiac patient? Breathlessness on exertion occurs in both heart as well as lung disorders. Now, the only differentiating point in asthmatics, the aggravating factor would be either cold air or dust, whereas in cardiac, the aggravating factor would be a physical exertion. Second, cardiac angina generally, unless otherwise, is always accompanied with some sort of autonomic symptoms like excessive perspiration, like sensation of going for urination but the urine doesn't come, excess of burps, excess of flatulence. If it is excess and along with it there's chest pain, you have to rule out a heart event, a cardiac event. So breathlessness on exertion. Many people have got choking. Now neck. Basically why neck is involved? Because the heart develops in the neck, in the small baby when the heart is being formed. The heart is the first organ in the body to be formed. As soon as the sperm and the ovum unite and they come down to the uterus, it is attached from the ovaries via the fallopian tube, they come out in the uterus and they attach. The time of attachment and the heart starts being formed. It takes around 4 weeks for the anatomical formation of the heart and 10 weeks for the 8 weeks for the heart to start pumping, and on the 10th week you can actually see the heart pumping. So by 10th week, if you don't have a heart beating, no heart sound on an ultrasound, then the child is no longer there. You have to, I mean, it's an abortion. The child is dead. So the heart is formed in the neck of the fetus and then it descends down in the chest. So that is why 90% of heart symptoms are related to the neck. It can be choking, it can be suffocation, it can be tightness, it can be excessive dryness in the throat, excessive, not relieved by drinking water. Many people complain, "Doctor, I have got excessive dryness in throat. I start drinking water, but that it is not the thirst, it is just the dryness, plain dryness." And people plainly miss, they don't even come to know that the person can be experiencing angina. It's a very common symptom, particularly in India. And I suppose in temperatures like in May in India, we have got 47 degrees to 50 degrees at Nagpur. And if person complains of dry throat, it will not strike me that he's complaining of angina. But if it is definitely on an exertion, "Doctor, I walked 2 kilometers up to a clinic and now I'm having parched throat." Exertion, throat pain, it could be angina. Then we have got stomach pain. Basically epigastric pain. It is not the pain, it is just a fullness. The typical fullness of a china or lycopodium I don't know if you know about the drugs like China, lycopodium, pulsatilla, carbovage. All these people have got a vague fullness in the epigastrium. They are unable to, I mean, they want that they should vomit out, they want that they should burp out, but the burp doesn't come, the vomit doesn't come. It's just a slight pain is there. What we can describe it as acidity. Again, acidity. Now, acidity and angina are very similar to each other. You can get heartburns up to the throat, same in acidity and same in angina. But with angina, you will get profuse perspiration on the forehead. You are likely to get or perspiration in the palms or perspiration in the soles. Now, suppose with burping or with loud burping and eructations or choking or heartburn, it's quite unusual to get perspiration in the palms. There's no need. But then the heart is giving a signal that it is sick. Shoulder pain. Many people get shoulder pain, and for years together, they misconstrue it as cervical spondylosis. You can have cervical spondylosis, but it is actually chronic fatigue syndrome for many. Most of the people who are in the urban area, we are not doing a lot of physical work, but we are mainly stuck to our computers and a wrong back chair. Basically, idle job, a sitting job. This is shoulder pain. Now, you can have these spasms. Okay. Now, if you have got shoulder pain, not the trapezius, not the sternocleidomastoid, but you've got the shoulder pain, then you should, and if it's bilateral, then something should raise concern. If the shoulder pain is there, but it has got no relation to movements, I can move my arm freely, then it is not frozen shoulder. It is not arthritis of the shoulder joint. It could be heart. If it is left shoulder, right shoulder. Frozen shoulder is differentiated if I have got pain and difficulty in movement. Are we clear? Cervical spondylosis or chronic fatigue syndrome. When these undergo spasms, you have got shoulder pain, but more stiffness than the pain. In angina, we have got more pain than the stiffness. Stiffness is not there at all. It's only pain. But in cervical spondylosis or chronic fatigue syndrome, you have got stiffness, you have got pain, you have got tingling, you have got numbness. Okay? So that is how you differentiate. So angina can present, as I repeat, chest discomfort that can spread to the left hand, upper back, right hand, breathlessness on exertion, choking, suffocation, palpitations, stomach pain, acidity, burping, and shoulder pain. Now, unfortunately, India leads the world in one of the two, in fact, the deadly disorders, and that's two deadly lifestyle disorders, and that is diabetes and hypertension. And this diabetes changes the entire scenario of ischemic heart disease, because in diabetes, after 2 or 3 years of the uncontrolled diabetes or even well-controlled diabetes, the autonomic nervous system starts hyporeacting. It reacts less, meaning thereby it will not bring out symptoms what the body wants to give you, like excessive perspiration. It will not be there. Pain is not there. So you can have silent attacks. In diabetics, particularly in young diabetes, people less than 40 years of age who tend to have atherosclerosis, they show total angina variants. They don't show classical angina like chest discomfort, like breathlessness on exertion, like choking, like palpitation. They don't. They would have vague symptoms like jaw pain, a left side jaw pain, or right side jaw pain, or only pain in the back, upper back, and you will not have a clue that it could be a heart disease. You will only think of something around the back, something around the scapula, but you will not even come to know that it is can be a heart attack, or for that matter, angina pectoris. The pain can radiate to the right arm instead of left side. It can radiate to both the arms, and there will not be pain. It will be just heaviness. Heaviness, typical like apis or natramur, wherein things start falling from your hands, the butterfingers which you call. My dear friends, this is an important thing, because nowadays diabetes plus ischemic heart disease is a very, very common, it's rather more common than the classical ischemic heart disease that we see. Again, diabetes plus hypertension. Now, hypertension, what it does is it causes increase in the size of the heart. It's a reactionary phenomenon. The more the pressure inside the heart starts expanding so that it can beat with greater force. But there's a time when it does that. Now, let us suppose this is the fist, is my heart, and the entire blood supply is there. Okay, in contraction and relaxation. Only and only during relaxation the heart receives the blood supply. Now, suppose if I've got this, so my coronary arteries is still here. Now, for some reason, the heart is expanded in size. This is the level of the heart. The blood is not going to reach up to here, it will end here. So that is why this part of the heart or this part of the heart is permanently ischemic. And that is there, and it causes a permanent state of angina pectoris. Whenever the patient walks a little, breathes very heavily, the patient starts having chest discomfort. This is called as hypertensive heart disease, hypertensive ischemic disease. And slowly and steadily, angina sets in. So it's very difficult from classical angina because there's a continuous, it's a Bryannia-like pain, pain aggravated on motion. Second, if you are on certain drugs for hypertension, then they cause tachycardia. And when you lie down on the left side or the right side, the tachycardia increases, palpitation increases. That is nothing but angina, but the modified angina. Unfortunately, people tend to give spigelia because spigelia is palpitations lying on the affected side. No, actually it is angina, but it is drug-induced angina. That means you are taking drugs for hypertension, causing palpitations, and thereby you are false. So till you don't remove that drug, you cannot hope to treat that person. So diabetes, hypertension are great modifiers of the symptom syndrome, what we call as hypertension. Something has happened to the screen. Okay. Now, throughout the world, can you see the screen?
Yes, we can see the screen.
Yeah, thank you. During the past few decades, the coronary artery disease in Southeast Asia have doubled actually as compared to anywhere around Australia, Europe, and America. And Indians living abroad have a greater prevalence of this disease than the counterparts there. As I said, atherosclerosis begins in early childhood, it continues throughout life and becomes apparent only in the middle age, and more so the epidemics is taking toll in younger ages. And that is why when I had to do my DNB medicine, the topic which I chose was why young Indians get ischemic heart disease. Why are young Indians prone for getting ischemic heart disease? I mean, before entering medical college, I thought you get a heart attack because you're growing old and there has to be some reason to die. But when I went inside, when I saw patients, 23 years old male coming with a heart attack, a 30 years old female coming with a heart attack, and I was perplexed. Why all these things are there? Anyway, so there are several investigations that can rule out ischemic heart disease. Electrocardiogram. Now, electrocardiogram, if it comes positive, then rely on it. If it is negative, if it's normal, and if still the symptoms are there, then do not rely on the ECG or EKG or electrocardiogram. Electrocardiogram is not a good investigation because in diabetics, an EKG or an electrocardiogram will come normal in spite of you having a grave disease. So that we have multiple cases to be seen. We have seen where the Patient has got heart attack, angina, deadly atherosclerosis, and yet the ECG is completely normal. So the only investigation of choice, the first investigation would be a treadmill. Now, before doing a treadmill, always do a 2D echocardiogram. An echocardiogram will assess how the functioning of the heart is. Sometimes, many times it happens, if you don't follow this echocardiogram, like you are a homeopath, you may not be doing echocardiogram, but if you have sent a patient uh, for doing a treadmill, and if the cardiologist obeys and just does a treadmill, and if the patient dies, there are many deaths on during the treadmill if it is done wrongly. So you have to do an echocardiogram, assess whether the patient is fit for a treadmill. Otherwise, you have to modify the protocol for treadmill. Only and only if you do that, then you have to say. And finally is angiography. Angiography only gives you the type of, the extent of the blockage, 70%, 80%, 90% A, and B, where is the blockage. Actually, where is the blockage is also identified by ECG. A person who knows how to read an ECG will tell you where exactly, in which artery, and artery which place you can have the block. So if you have a good reading of ECG, every homeopath should be able to read an ECG. Okay. So how do you approach the patient? A patient who has come to you, there are three patients who come to you. Number one, doctor, I have a family history of heart diseases, and occasionally I feel heaviness in the chest. Occasionally I am feeling acidity. Occasionally I feel a lot of perspiration. Other people in the room don't feel. So can I be suffering from heart disease? So this is called as a heart disease, ischemic diathesis. That means a patient has, and I have got in the family history, my mother and father, they have got heart disease. So can I have? This is, I am having a predisposition to heart disease. I have yet not developed a full-fledged disease, or at least I don't know if I have developed. This is the first group of patients. Very, very easy. Give a constitutional drug, modify the life, because it's a lifestyle disorder, modify the lifestyle. Modification of lifestyle involves the appetite, the thirst, the specific desires and aversion, sweating, stool, urine, sleep, sexual relations, and menses. All need to be in a particular time. For example, sleep. Sleep is one of the most important parameters. It is 10 times more important than exercise. If I am sleeping only for 4 hours of day, or a 5 hours day, or I am sleeping for 9 hours but unrefreshed sleep, I am ready for a heart attack. So the first thing you need to correct is sleep. The second thing you need to correct is stools. My bowels should be better, and for stools, instead of medications, it is better that I do exercises. Sexual relations. Many people, I don't know, have got weird ideas of sex. But if people are not sexually satisfied, they are actually bringing out a hypertensive state, and thereby leading to a heart attack. So that is very, very important. And this has to be told to the patient. Do not shy away. You are physicians. We are physicians. And it's a duty to educate the person that this is as important as appetite. Like many people, they renounce sexual relations and become priests, become saints, they go into nunneries, or they may go into different temples. Then they have actually cut off one important aspect of the life, one important physical gender, and that is going to ultimately harm. You have to see the past and family history. Constitutional similum should be selected and choose the correct potency and in ascending power. For example, if the drug is lycopodium, you start with lycopodium 30, 200, 1M, 10M, 50M, CM. Now this is called as Kent's octave scale. Kent has introduced an octave scale. You start with low potency and increase it to high potency over a period of 1 year, 2 years, 3 years, depending how you feel the state. For example, if I've chosen lycopodium, I normally repeat lycopodium once in 4 months or 6 months, one potency, because my patient has to last for 5 years. until the patient is there with me for 5 years, I'll not be able to completely cure him or her. There are many times it's very difficult to select constitutional simillimum or constitutional remedy. Then what you do is we start with an acute drug, we tackle the symptoms in short time, and then if on angiography the patient has the blocks in the coronary artery and doesn't want to go for angioplasty or bypass or is unfit for some reason, then we have got certain drugs that can stabilize the blocks and in few cases even regress it. Yes, in a few cases even regress the blocks. And those few cases, I should omit the word few from my practice because there are many cases, and we have got proof on angiography before and after when the patient had come to us before and after the patient therapy, the regression of the plaques. One of the very important remedies for this plaque regression is a mother tincture called as Terminalia arjuna. It's an Indian remedy. It has been used from Vedic times, prehistoric times, much before Christ. And till today, 2020, it remains to be the finest homeopathic remedy for actually decreasing plaque size, either in the arteries or in the veins, not only in the heart, anywhere in the body. Innumerable tests, studies have been done and it's been proved beyond doubt. Still very unfortunate why modern medicine has not picked up this drug and has propagated or may not made a patent out of this terminal arjuna. So it's untrue that all patients who have been detected as blockages or this should always undergo bypass or angioplasty. I've got so many patients under my care who do not want to go for angioplasty or bypass, and then I realized this strategy, this marketing strategy by big hospitals, wherein they have to actually complete the quota of a particular amount of patients for angioplasty or bypass for monetary gains. But then so many patients who have proved double vessel disease, triple vessel disease, single vessel disease, and for years together they have not had any problem and they have not undergone bypass or angioplasty, and they are perfectly well. They can do every single job. What these people don't report in angiography is the neovascularization, because it's a rule that suppose if this is the artery and where this artery is blocked, then another artery, a small branch is going to start. This is called neovascularization. The vital force does not give up, whether you treat it bypass or any external factor. Vital force knows how to survive. So what it will do, it will start creating new vessels. This is called as neovascularization. This is how cancer survives in the body. So it's a rule. Now, since it's a rule, it is applicable everywhere in the body. In the heart also, we have got neovascularization. And suppose if this artery is blocked, okay, let it be blocked, but the blood is supplied from the neo. Now, this neovascularization is not reported purposely in majority of reports what we see in angiography. Because if they report that, then there's no need for bypass, or people will rethink whether to do bypass or whether to do angioplasty or not. So that is a game. Anyway, in homeopathy, we are lucky that we have got remedies like this terminal arjuna, which not only can decrease the plaque size, but also increase this neovascularization, increase this new vessel formation, and thereby actually cause a natural bypass. Now, the second most common disease found in the world is hypertension. It's one of the costliest disease, and unfortunately India is the world leader. Why is it a costly disease? Because there are direct costs involved in the screening of the disease, in the diagnosis, in the clinic visits, the lab tests, drugs, adverse reactions of those drugs, transport cost. Right? If you go to the doctor, you actually have transport cost, right? The time lost from the work, and the indirect cost, the income lost due to absence of the work, cost of therapy for coexisting conditions. Because there are very few people, out of 100, you will only have 10 people only with hypertension. The rest 90 will have hypertension with diabetes, or hypertension with diabetes plus heart disease, or hypertension with hypothyroidism, hypertension with hyperthyroidism or something else. So those comorbid conditions also are many. When you talk about hypertension, particularly in the Indian subcontinent, as compared to other people, the biggest factor is the truncal obesity. Now, truncal obesity is because of hyperinsulinemia. And insulin loves fat. What it does, it catches the fat from the blood and deposits in the subcutaneous tissue. And the favorite size for subcutaneous tissue is the belly. And you have got, Indians are basically called as Humpty Dumpty. Humpty Dumpty means you have got very thin arms and forearms, but a very big belly. And that is the biggest cause for our hypertension and ischemic heart disease. Second is tobacco. Yes, tobacco chewing with lime and without lime. Loads of Indians add lime in tobacco. So if you don't add lime in tobacco, it is bad for you. If you want to, if you're a tobacco chewer, if you add lime, it at least dilutes. Smoking. Alcohol. Now, alcohol per se is a cardioprotective agent. I repeat, cardioprotective agent, alcohol per se. If it is drunk moderately, so although I have never touched alcohol, and yet I give sermons about drinking alcohol because it's just, I've done a thesis on that. So, how do you drink alcohol? Number one, for years together, much before the Western civilization, Indians used to drink alcohol. When the Britishers came in, that alcohol no longer exists. Indians were introduced to Western alcohol, like wine, like beer, like whiskey, like vodka, gin, rum, etc., etc. Now, when an Indian drinks indigenous alcohol, for years together, nothing happens. But when an Indian drinks Western alcohol, then you have to follow that procedure. In the West, people drink alcohol, yes, much more than Indians do. But the thing is, they never have alcohol and snacks together. Except in wine, you don't drink. Like in India, it is mandatory that with alcohol, you add water, you add soda, which is 10 times more deadlier, soft drink, which is not good at all. Soft drink has a lot of calories and a lot of sugar and alcohol. You have mixed those two and you have given the liver a huge blow of calories at one single point of time. So, if you have got alcohol snacks, whatever snacks may be, and even if you say salads, but on the salads you definitely add salt, and salt and alcohol don't go together. So basically, in Indians, if you want to drink alcohol, just stick to the alcohol. The quantity should be same every time. Number two, the body should know how much you're going to drink. What is your label? What is the type of alcohol? Like if it's summer, you don't go on drinking beer, and in winter, you don't go on drinking brandy or rum. If this body is suited, actually, the type of alcohol you should drink depends upon your blood group. For example, O positive, they go very well with vodka, whereas B positive, they can have beer. O positive do not go well with beer. Just for your knowledge, it's given on the internet, you can find out. Then dietary excess of sodium and fat, deficiency of potassium and fiber. Potassium and heart, they are very close friends. The more the potassium, unfortunately in India, the salt which we get is iodinized salt. Now, other than some parts of Himalaya, sub-Himalayan territory like Assam and Himachal Pradesh or something, so some of those areas, the rest of the India, we have got a lot of ample amount of iodine in the salt. We don't need iodine in the salt. But now, since Government of India has made it mandatory that everyone should have iodinated salt, it becomes a very perplexing situation, and there's a very high rise of hypothyroid patients and hyperthyroid patients. So, you should have, people in the coastal areas should have common salt, NaCl. People in the plateau areas should have rock salt, KCl, potassium chloride. Drugs that can cause BP rise are simple painkillers, NSAIDs, non-steroidal anti-inflammatory drugs, oral contraceptive pills, nasal decongestants, cyclosporine, erythropoietin, steroids. All these are known causes of hypertension. Now just imagine you have an asthmatic or a person who is suffering from nasal allergy, taking those drops, nasal drops, for say 3 years and coming to you with high BP, and you're giving ABCD drug and trying to control the blood pressure. It's not possible. You cannot do that. So don't do, first remove the maintaining factors. Now, hypertension also has got, it will give you a long time before it brings complications. It has got vague symptoms like irritability. These are the first things. A person who is otherwise very mature, a very stable, a very social person starts becoming very hypersensitive, excessive sensitivity to noise, to some other people's remarks, irritability, mood swings, lethargy, fatigue, unusual weight gain. And that weight gain is not because of muscle mass or you have done something, it's because of water retention. And the first things you start seeing is swelling below the lids, swelling above the lids, or swelling in the ankles. For example, if a patient says, "Doctor, I have to travel about 60 kilometers, and I have been a teacher since past 10 years. For so 10 years, I have been traveling 60 kilometers daily, day in and day out. But now, since past 2 years, what I'm noticing is, I travel to and fro. When I come back home, I start having swelling on my ankles. So is it normal? No, it's not normal. It is an indication that your body is storing water, retaining water. You are going towards an antremor state. You are going towards a hypertensive state. Recurring vertex headache, this type of headache. Now, in hypertension, you can get two types of headaches. One is the throbbing, clonine type of headache, a vertex headache, when the BP is too high or very fluctuating. 200 by 110, 230 by 110. That is the BP, and you get a throbbing vertex headache. Or you have got a BP 160. My normal BP is say 130 by 80, but today because of some stress, my BP is 160 by 90. So 160 by 90 is not a very big BP, but I will get a headache which is the heaviness of the head, a typical gelsemium-like headache. I'm going to get vertigo, not actually vertigo, but a slight loss of balance. Once it's okay, twice it's okay, but if it's a recurrent phenomena, I should check my blood pressure. Urinary frequency. If I am unable to control my urination, particularly at night, then it's an indication because the body tries to release the pressure by urination. If I don't release the pressure by natural outlets, then many people start having bleeding, epistaxis. That is a sign of high blood pressure, particularly in hot places. When the temperature goes beyond 43, 44, 45, 46, 47 degrees, it's severely hot. At 2 o'clock in the afternoon, you are in the sun, and your BP rises, and you get profuse mellitus type of bleeding. Mellitus is a specific remedy for excessive headache, high blood pressure, and epistaxis. Now, multiple double-blind trials at our center, Aadil Homeopathy Center, have proved beyond doubt that homeopathy alone can manage hypertension and its complications as hypertensive heart disease, or hypertensive heart enlargement, or stroke, or chronic kidney disease. We have been preparing protocols since a long time. It's been 20 years that we're preparing protocols and following them. Regular blood pressure monitoring, relevant investigations that can streamline therapy. Yoga, Shavasana. Shavasana, Shav means dead body. Asan is a pose in the dead body. When you take away your feelings, it's a very, very difficult asana. One of the most difficult asanas. It's called the queen of all asanas. And it seems very simple. You have to just lie down, relax. Saying is easy, doing is that much difficult. For the earlier part, you have to be under someone's guidance. Someone will guide you to do the Shavasana. Once you are actually able to do it on your own, then you can go on for cassettes or CDs and all. So yoga and shavasana is a mental relaxation, is a boon for rehabilitation following heart attack and hypertension. Pranayam is an exercise which you take in deep breaths in and release out. Again, it seems very simple, but it is not just taking deep breaths in and releasing it out. It is not deep inspiration, expiration. It is the realization of the breath going inside deep and opening up of chakras. There are different chakras. I'm not going to go into details of those chakras, but you can open out those chakras. So isotonic exercises like walking, jogging, swimming, racket games are more preferable than isometric exercise like weightlifting. And I always say, cultivate a hobby like music and painting and start relaxing on weekends. Problem is, we earn for others, we don't earn for ourselves. And we don't know how to relax. Majority of people, they don't know they've lost this, they have lost their laugh. They're just tight-lipped, they can't even smile. Or at the most they can smile, but they can't have a hearty laugh or even a hearty cry. People who have forgotten to cry, teach them to cry. If they've forgotten to laugh, teach them to laugh. It is one of the finest methods of controlling hypertension. Valvular heart diseases. In the early stage of rheumatic fever, now, rheumatic fever is a common, very common reason why we get this valvular heart disease. It's completely curable. Now, rheumatic fever actually starts from the throat, and it's said that the streptococcal infection, recurrent streptococcal infection, if it is suppressed either by recurrent homeopathic medicines or allopathic medicines or herbal medicines, ultimately it will leave the throat and starts biting the joint. So it starts from the throat, it touches the joint and bites the heart. This is how rheumatic fever travels. Rheumatic fever is the classical example of a tubercular miasmatic state. It is very erratic. It changes joints, it changes places, it changes the type and pattern of fever, it changes its modalities. It's a very changeable fever, but it is completely curable with homeopathy. Even recurrence can also be effectively tackled with deep-acting constitutional remedies or no source. But the prime aim of a homeopath is to recognize it as early as possible, particularly in people like India or Indian subcontinent, in Africa, and the entire Africa. So Asia and Africa is still the home for valvular heart disease and rheumatic fever. We have to be very alert and we have to recognize it. In gross pathological states also, our remedies can palliate. For example, you've got severe mitral stenosis, severe aortic stenosis, mitral regurgitation. So our remedies will not repair the valve. VALV valve, which is gone, it cannot be repaired. It can be only repaired by surgery. But then there are times when you can't do a surgery. Patient does not want to do a surgery. Then what? What you do is you just maintain the patient, start decreasing the allopathic drugs, and start introducing homeopathy slowly and steadily. If you are afraid of giving potencies, give mother tinctures. But homeopathy has a much better compliance rate and a much better effectivity than other modes of system of therapeutics. That has been proved beyond doubt in our studies. Heart failure. Now, this is the ultimate dreaded complication of the heart disease. You have an acute heart failure wherein it's very difficult to save the patient. It's practically impossible to save the patient because the patient is going to give you just minutes. An acute heart failure just give a heart attack can give you 1 hour at the most, 2 hours, 3 hours. But a heart failure will only give you acute heart failure to give you minutes. So forget about saving acute heart failure. In chronic heart failure, the pumping capacity, which is normally above 80% in a normal individual, starts decreasing to 30%. If it is 30% or less, we call it as cardiomyopathy or heart failure or a chronic heart failure or a chronic congestive cardiac failure. And the symptoms are breathlessness. It's the first symptom and the most sustained symptom of heart failure. Breathlessness that is aggravated by exertion, a perpetual edema, a perpetual swelling either below the eyes, on the feet, generalized on the body, a cough, which is classical cough. This is the cardiac cough. You can see here the metallic sound. That is a asthmatic cough, or that is a lung cough, urinary complaints, constipation, dry skin. Why constipation do you get? In practically all heart patients, you have constipation. The reason is GIT is the most least preferred organ in the entire system, in the entire body. Whenever there is a competition for blood, the heart gets the first preference, the brain gets the first preference, brain and the heart, and the last preference is given to the GIT. That is why when the heart is sick or the brain is sick, they take all the majority of blood inside, and they leave very little for the GIT to only to just survive. And that is why you have a very, a constipative state in practically all heart complaints. Now, since India also tops the world in diabetes, persons suffering from both heart disease and diabetes are at particular risk for heart failure. The only good investigation for heart failure is an echocardiogram, and there's a tremendous scope of study, tremendous scope of homeopathy in chronic. In fact, very recently I had published a paper on the role or comparison between Strophanthus, Adonis ver, Fasciolus nana as compared to digitalis in role of congestive cardiac failure. We have got Carboveg, we have got Squilla, and mind you friends, maximum deaths in the heart patient, for corona patients, the present corona patients, the maximum deaths are because of heart failure. And it is here you need to use Squilla. Squilla is coming as the remedy of choice for the heart failure because of the myocarditis of the coronavirus. Because of the thromboembolism coronavirus, Squilla and Strophanthus, they are very, very important in this to save patients in the present scenario. Then we have got arrhythmias. Now, heart muscle has its own electrical supply as well. A certain group of heart muscles, they are very powerful, and then they take up, then every single heart muscle has the power to generate electricity. But then heart is a single cellular organism, meaning thereby there are multiple cells anatomically, but they all work as one. So you need a guide, you need a leader, and that leader is the SA node, the sinoatrial node. So suppose if the sinoatrial node is disturbed, then the rhythm is disturbed, the function is taken away by another node of the heart, another electrical pole of the heart, and that's called atrioventricular node or AV node. Again, if that is broken, if that is destroyed, then you have got individual heart muscles, they start beating alone, and you get various types of arrhythmias. If the heart can beat with unusual fastness, it is called as tachycardia and tachyarrhythmias. It can beat very slowly and irregularly. You can have bradycardia and bradyarrhythmias. Many people will require a pacemaker, many people would require ablation therapy, but in homeopathy, we have got established drugs to treat tachycardia and bradycardia, and that too quite effectively. In modern medicine, there are only 2 to 3 drugs at the most for treating arrhythmic disorders. Most of their drugs are managed. One is the Cardiron, and one other is Virapamil. It's a calcium channel blocker. Other than these two, you hardly have any drugs. But in homeopathy, we have at least 17 to 19 proved drugs for different arrhythmias. I've again published papers on role of homeopathy in rhythm disorders. I know for many young practitioners here, it will be a bouncer. They must have heard for the first time. But people who follow me on the Facebook, I'm on Facebook, people who follow me on the Instagram, people who follow me on YouTube, they would know that I have published all these long back. Congenital heart disease. The incidence is rising day by day. These disorders like ventricular septal defect, atrial septal defect, patent ductus arteriosus, tetralogy of Fallot, and loads of other names put the life of the fetus and the newborn at stake. Now, what role do homeopaths have here? The disorder has already occurred, okay? The baby is already born with this disorder. So unless until you have a surgery to correct it, you cannot treat it completely. But suppose if a female has given a birth to such a baby previously and now wants another child, can she come to a homeopath and say, doctor, can I be vaccinated? Can I have a baby which is next baby should not get this disorder. Yes, just give her, the husband, and herself one dose of cephalosporin 1 m, and the next pregnancy, in our experience, you will not get all these disorders. Suppose if the female is positive for torch, torch is a viral infection, uh, VDRL is a syphilis, HIV, she's positive, then there is greater chance of getting such disorders. Again, give a dose of cephalosporin. That is not to get diseases in next pregnancy. And suppose the patient who is suffering from VSD or ASD or PDA, then we have got symptomatic or pathological drugs like against Strophanthus, like Digitalis, etc., which can stabilize the patient till the patient goes on for surgery. My dear friends, I know I have a lot to say, but then there are a lot of hurdles for homeopath, particularly when you are managing emergencies and cardiac emergencies, because there are no formal practical training for managing emergencies in any medical college in India at least. In India, we are lucky that BHMS and MBBS are the same level legally, but when you go to the ground level, there is not a single hospital which provides emergency management courses. The remedies are remedies, the homeopathic remedies are not proved to the level of biochemical or pathological changes, but only clinical symptoms or observations are seen in improvings. The drug selection becomes difficult because the time is less. When you're called to an ICU, you have a very less time. Artificial settings are there. There are few or no PQRS symptoms. So we don't get a full case. Only for a particular symptom, the homeopathy help is resorted, and you have to just still, even after that, you have to prove your point, you have to prove homeopathy's acts, and it's not a placebo. Homeopaths are very untrained in legal formalities and the legal implications of your degree, the BHMS. You don't know the rights and privileges of the word BHMS. Can you issue a death certificate? Are you under Consumer Protection Act? Can you administer IV fluids? Can you administer blood? All these things need to be known by a homeopath, particularly who's practicing in India. Other countries, they don't allow this much also, but in India, we allow. So my dear friends, what have we been up to for all these years? This is my last and final slides. After delving into homeopathy cardiology for the past 20 years, we have established a proper hospital, we have a proper staff, we have the tie-up with other ICCUs of the city. We have skills like using gadgets for case assessment and drug delivery, protocols. Many protocols are developed like ISRA protocol, heart attack or infarction protocol, diabetic protocol, renal protocol, hypertensive protocol, so that even in my absence, my junior can see the protocol, select the remedy, and start the therapy, even if I am not there. Discussions with colleagues on daily rounds, case and journal presentations are very, very essential to develop what is called homeopathic cardiology. Reproving homeopathic remedies, we have till now today reproved 28 drugs. We have conducted so many pilot studies like 3-year NAJA study, heart failure study, a pulse home trial, Alismo trial. I mean, loads of trials. Greater use of nosodes, sarcodes, tautopathy, and external applications are very important when you are dealing with emergency cardiac patients. CMEs and greater training centers are important, and you have to ultimately educate the mass, the common public. You may be a highly educated person, but if the common public does not know that you can offer so much, they will not come to you. So it is our duty to advertise ourselves well, to advertise the system well, train the masses correctly, and give them homeopathy. My dear friends, homeopathy cardiology is a long, long way to go. It has come 20 years. Single-handedly, I have carried the torch, and I want that everyone in the world should offer homeopathy as a first choice to all cardiac patients. Thank you very much.
Hello.
Yes.
Dr. Adil, that was beautiful. It was really so much thing to learn. Every time we hear, it is always something new, and everything was so well planned, and so much to learn. And we will take the questions. And as when you said like the chakra, the heart chakra, green color is the heart chakra. So that makes them less anxious and everything. So I just remember that chakra, that green color.
Any questions?
Yes.
Thank Billah Akil. Thank you very much.
Yes. And thank you so much for taking your time. It was wonderful because you have several hundreds of patients in this busy schedule with COVID-19, but still you took the time. That was so nice of you. And we will take some questions, please. Okay. So, uh, Professor Regina and Dr. Sweta, would you like to take from the chat, please?
Yes, please. I would like to know, Dr. Aadil, if calcified aortic arteriotomacies are treated with homeopathy with a positive outcome. And how is your experience with that? And which remedy would you suggest, Dr. Aadil? Thank you
For
for
what?
the
So I could not get you. So please, could you repeat your question, please? For what? Which condition?
Calcified aortic ateriotomatosis. If
Okay.
it's
Great,
treated
great.
with
Yeah.
homeopathy. And
Very
what
good question.
remedy would you suggest, sir?
Yeah.
Thank you.
After 60, 65 years, as our hair grows white, graying of the hair, similarly as the joints age, so also the aortic wall. Now this aortic wall is very particularly, it starts getting calcified, okay, slowly and steadily. So you develop an aortic stenosis. And the moment you develop aortic stenosis, then you have to, your BP rises, your blood pressure rises. So your doctor puts in on more blood pressure medicines rather than correcting this. Now, the only treatment in modern medicine is surgery. But I don't advise surgery because we have got remedies like Sumbul. Ferula Sumbul is a specific medicine to control the hypertensive state as well as the calcification. It arrests the calcification of the aorta there and there. Like suppose if you've started at the age of 70 and you have been having calcifications since the age of 65 and you've come to know just now. So you start taking Ferula mother tincture, Ferula Sumbul mother tincture, and you will find a tremendous relief, not only in controlling your blood pressure, your BP medicines are going to go down. At the same time, the symptoms are going to decrease because the symptoms of chest pain, the aortic stenosis would be a persistent chest pain, which increases and decreases the respiration. And second is syncope. Suddenly you faint, and then you get up. This is a very, very common this, and we don't want people to go for surgery. So Sumbul is a very, very specific medicine in our experience to deal with such a situation.
Thank you, Doctor. Namaskar. Wonderful.
Thank you.
And how
Yes,
did
any other questions?
for the audience, we would like to put it in the chat. Can you please? So the remedy which you said?
Ferula Sumbul. Ferula Sumbul. Ferulla Sumbul. Sumbul. Mother tincture. Because it's a pathological prescription, that's why mother tincture. It cannot be taken in potencies. And you have to continue for at least a year or two to get it takes minimum 3 to 4 months to show its effect.
And Dr. Hira, you have a question. Okay, go ahead. Sweta, do you have any more?
Good evening, Aadil. It was a grand session, and only one question. You have done a great job, cardiology and homeopathy. One heartfelt request to you that if you can make our homeopaths, at least of India, understand this basic cardiology and homeopathy with all its details, one by one, the protocols that you have prepared. So I think that will be a great boon to the fraternity, to homeopathy, and to the suffering humanity, especially with cardiology. So can you chalk out some, because people can't come to Nagpur, but sitting at home, technology available. I think you should chalk out some plans to make us understand cardiology and homeopathy. I have been writing to you since long that you should take up this chance of making all homeopaths trained under your able guidance, and see that homeopaths become more stronger in this cardiology department.
See, if you want to be a good surgeon, if you want to develop your skills, you have to go to a surgeon. You cannot do online things every time. I can tell you the protocols, but you have to see the action of protocols. That is why I invite for past 32 years, we have been conducting postgraduate schools. You say you cannot travel to Nagpur, but you can travel everywhere else. So if you want to develop any skill, you have to go to the place where it is done practically. Certain things cannot be taught online. Although I've been right from the beginning of a practice, I've been delivering lectures all over the country and the world, everywhere. Online, I have a YouTube channel which is running very well every single day. Many of my viewers here are viewers of my channel as well. They know that I have freely and steadily I give away the knowledge. But the problem is, training requires to come here. I cannot monitor you. I can give you information, but you cannot be trained with that information. Training, a guru has to train, a teacher has to train under his eye. So for that, you have to actually come to the place where the things have been done.
Okay, thank you.
Hello, I
Hello,
wanted
Dr.
to
Aadil,
ask.
sir.
No? Yeah, this is Dr.
Yes,
Sumita
ma'am.
Grover. I
Please.
want to ask Adil, what is the role of patents like gold drops in Requec company or Tonicard by SBL company and so many other companies are making, and the doctors are prescribing those patents to the patients. So what is your advice and what is your experience regarding that?
Well, in the absence of a good homeopathic practice, many homeopaths unfortunately go in for these patents. It is because of their lack of knowledge, their lack of selection of a particular homeopathic specific or pathological prescription of homeopathic drug. They cannot do so, and somehow the patients also feel better. But why give so many patents when a single drug can do good to you? I'm not against patents, because in the present scenario, 90% of homeopaths are still, even at this stage, even after, I'm talking about Indian homeopaths, even after undergoing BHMS and MD and all, they're still dabbling with selection of a simillimum, either partial simillimum, pathological simillimum, and a constitutional simillimum. So in this scenario, patents, although homeopathically, philosophically it is wrong, but still many people do, many people are better, many people at least are avoiding surgeries, all these. But then, as far as I am concerned, I want single medicine. Even pathologically, one single drug can do your job. I'm not against it, but I'm not for it also.
Thank you.
Third, there is another question from the chat, and Dr. Harit saying a male 66 heartbeats per minute is always normal, but there is a slight swelling under the eye. What would you suggest to do?
Oh, okay. What do we suggest? Wait and watch. We suggest, does that patient, I don't know, what is the age of the patient?
66-year-old.
66 years old. Oh, now, does he have additional hypertension or diabetes or anything else? If not, just alter the lifestyle, decrease, just wait and watch. No medications to be given. Just wait and watch, but be aware that it may not turn into something else. You should find out the reason why you have got swelling below the lids. It is not normal. There has to be some reason. But just don't start giving drugs like Natramor or Apis just because you've got swelling. No, don't do that. Wait and watch. Homeopathic medicines are treasured. They should be given only when indicated, otherwise not. So wait and watch is the best method.
Thank you. There is another question. How cactus and crataegus help in heart problems?
Crataegus.
Dr. Uranus. Cactus and crataegus help in heart problems.
Cactus and Crataegus. They are two different remedies. Unfortunately, most homeopaths equate heart with Crataegus. I don't know why. For all these years, the use of Crataegus in my practice is absolutely negligible because it hardly works. It has a very, very specific action, and that's only on hypertensive heart disease. When the heart is enlarged, and that time you're having chest heaviness, that is the only part where Crataegus is, works. Otherwise,
मैं जाऊंगी इनके पास 1 साल के लिए.
इसके पास?
इनके पापा, इनकी मम्मी, इनकी.
Hello, Shreya, can you mute yourself? Thank you.
So that is the cactus. It's a well-established drug. Now, in high potencies, it is very, very good medicine because it was specific type of pain, and it can tackle even heart attacks, as well as in mother tinctures, it can decrease the it can alter the intracardiac pressures. We have measured both of these. So, cactus in different potencies acts differently on the heart. In potencies, it acts as a similimum, whereas in mother tincture, it acts as a preventive remedy. Again, it's a very, very good medicine for hypertensive heart syndrome or cardiomyopathies as well.
Thank you, Doctor. Namaskar.
Thank you.
Dr. Aadil, would you like to take few more questions? If it is
Yeah,
okay?
I don't mind. I don't mind.
One more.
Hello.
You asked syphilinum on pregnancy. So,
Dr. Sweta, the voice is...
I cannot hear.
Yeah, your voice is crackling.
Hello?
Yeah.
Hello.
Yeah, am I audible, sir?
Yeah, now you're audible. Huh?
Okay, I'm saying you were asked to give syphilinum and sulfur during pregnancy. So, at which month it should be given?
As before the pregnancy, before the conception.
Before the conception. Okay, thank you so much, sir. And one more question is there. Do you have any experience with LM potencies?
I practice exclusively LM potencies. I practice exclusively LM potencies.
And how one can reach you, Dr. Aadil? What would you say, how to reach you?
Reach me. Oh, it's very, very easy. I'm all over the social media. I'm on Facebook, I'm on Instagram, I'm on YouTube by the name of Dr. Aadil Chimthanawala, Aadil Chimthanawala. So you just type it out and you can reach me.
Thank you so much, sir. It was an excellent session. Thank you.
Thank you very much.
Hello, sir. Can you hear me?
Yes.
You said you could we have to come to you to learn. So,
Yeah.
what is the course which you are offering if we come to you to learn cardiology?
There are two courses. There's a summer school and a winter school. Unfortunately, because of this COVID-19, our summer school has been postponed. I don't know when. It was supposed to be held in March. We postponed it to June, and now we have postponed it. I don't know till when. So it's a 10-day course, and we actually from morning till night we deal with patients and tell you how to go inside the patient, how to understand a heart patient, what exactly. It's very easy to give you a protocol. It's not easy, difficult. But then how do you follow, which potency, everything needs to explain. And first of all, you have to see whether those medicines act reality or not. There are so many innumerable medicines in the Mathematica, but all these homeopathic medicines act? No, they don't. So unless and until we conduct courses, and the courses are advertised well in advance, so summer school and winter school, you have to take out time, stay with us for 10 days, and then we can go on. Then I can train you online also, because you know my thought structure, you know how we see patients, you know exactly the basics of how we practice. Homeopathy cardiology is subspecialty or super specialty. It just cannot be trained. People cannot be trained online. This is an art as well as a science. So you need to come to us and learn.
Sir, is there
Thank you.
anything we must note in patients with artificial pacemaker, sir?
Well, artificial pacemaker, 3 to 4 things. You have to regularly check the battery. That is every year. That the pacemaker people will only do. Number two, do not let the patient grow very fat, so that the blood supply should not increase too much. Right? The heart does not need to function extra than what is already being done. Third, they cannot undergo to very high altitudes or deep down under the sea, like scuba diving and all this, for absolutely forbidden. So if they stay in a normal life, eat normally well, and heavy exercises are forbidden, like gym, weightlifting and all, they cannot do that. Other than that, it's a normal life and no problems.
Thank you, sir.
Thank you all, and we will bring Dr. Aadil again because so many are asking that they need again your session, Dr. Aadil. It was so nice. And for more questions, Dr. Aadil will answer them. You can send us to castedygroup@gmail.com, or you can directly reach Dr. Aadil, and we will bring him again back. And any more you wanted to say, Dr. Aadil? The last.
Well, my final take-home points is homeopathy is still an untapped potential in managing complicated cases. What is needed is faith, conviction, focus, devotion, thirst for knowledge, openness to admit mistakes, courage to stick to your work in spite of anything, and an attitude of gratitude to your Almighty, to your gurus, to your patients, and your students. Everyone who's taught you, you should be grateful to them. I think if every homeopath follows this, then homeopathy cardiology would be #1. As Thuja is for warts, then for every heart disease, homeopathy would be the #1 choice. Thank you very much.
That was very nice, Dr. Aadil. And all the participants, thank you for attending. Sorry, due to out of time, we are not able to stay for long, but we will bring Dr. Aadil back. And just I would like to announce the upcoming event, JAC 2020, Virtual Global Pandemic Summit. In case if you haven't registered or would you like to know more, please visit the website jack2020.org. And there are some videos for the promo also, which are posted on kavitakehomeo.com. This is the historic event with this virtual thing. And the main thing is the Nobel Prize, Nobel laureate, discoverer of HIV, Dr. Luke Montagnier, will be there at this conference speaking about homeopathy, the future of science and medicine, which is an exclusive presentation. And I will be there at this conference speaking about effective pain management in ENT diseases. So thank you so much, Dr. Aadil, once again for coming over to our webinar in spite of your busy schedule. And I thank my class study team for helping with all this, and all the audience for participating. So stay tuned to our future webinars. And we are having Dr. Divya Chabra coming for the month of July. So we will update all the details soon. And until then, visit us at, for updates, kavitakehomeo.com or castedygroup@gmail.com. Thank you all once again. Stay healthy and happy.
Wonderful session. Thank you very much. Namaskaram.
Thank you all. Om Shanti.